It was so cool to wheel someone on my bed. I got them to a scanner and maybe got them their stroke med a little bit sooner. I just thought that was so empowering. And then I would have days where I would literally get to the base. There'd be no truck. I'd get in a taxi. I'd go to the hospital. I'd go to the back hallway of Etobicoke General. I'd sit there for 12 hours. I'd get back in a taxi and I'd go back to base. That is not what I trained for. Not to say it's not important work, because, every patient needs to be supported in our crumbling healthcare system, but it wasn't the work that I had signed up for. And so I wasn't feeling self-actualization. And so even though I didn't do a hot call that day, I was burnt out. Actually, a hot call might have reduced my burnout. But to bring it back to paramedics, I think one of the biggest challenges that has gone unaddressed by governments and leadership teams is the change in the work that EMS is currently doing compared to maybe what it did back in the 90s. The training for EMS is still very resuscitation focused. And so you're pumping out a bunch of resuscitators, right? A bunch of people who maybe thrive on adrenaline. They seek instant gratification from being able to convert SVT to normal sinus, or auscultate and hear that the wheeze from asthma has gone away because it's been treated with a steroid and a puffer. And paramedics go, I did a good job today. I saw the job that I did. I saw my work in front of me. People got better. People tend not to get better sitting in offload delay for 8 or 9 hours. And so you're standing there, you're not even really providing them with the service that they should have in a hospital, because that's not part of your role. It's not part of your training. It's very unsatisfying. One of the most satisfying parts of being a paramedic was when we got the stroke protocol and I was able to wheel someone to a CT scanner and put them on a CT table. I just felt so empowered by bypassing the emerge and actually using my stretcher, like my 35A. Oh my God, am I dating myself? What are they called now? They're not 35. They don't have handles anymore. Yeah. Okay. Anyways, it was so cool to wheel someone on my bed. I got them to a scanner and maybe got them their stroke med a little bit sooner. I just thought that was so empowering. And then I would have days where I would literally get to the base. There'd be no truck. I'd get in a taxi. I'd go to the hospital. I'd go to the back hallway of Etobicoke General. I'd sit there for 12 hours. I'd get back in a taxi and I'd go back to base. That is not what I trained for. Not to say it's not important work, because, every patient needs to be supported in our crumbling healthcare system, but it wasn't the work that I had signed up for. And so I wasn't feeling self-actualization. And so even though I didn't do a hot call that day, I was burnt out. Actually, a hot call might have reduced my burnout. I wish I could have done a hot call, because that's what I was trained to do. And I don't think, but we know this from call demographics over time. We know that the calls are becoming less acute, or that we're doing more low acuity calls. And so that is changing the dynamics of our work. And I don't think anyone has really addressed that on a needs basis. I'm like, what does that mean for a paramedic's job satisfaction when you go to work and nobody is really sick? Because you spent your years of college or university training to help really sick people. For me, that's actually what drove me out of paramedicine and into med school, is that I felt like I wasn't doing what I was born to do.
And then the medics on the road today, well, if you ask them, what did you do today, or what did you do yesterday? A lot of them will say, I have no idea, because they're already tuned out.
So this brings up a whole bunch of other aspects of, let's say we don't want to be burnt out anymore. What is the opposite of burnout? The opposite of burnout isn't entirely clear to me. You actually have to sit with yourself for a while, because if we just eliminate burnout, right? Let's say you don't feel stressed at work anymore. You still might not enjoy your work. You still might hate your job. You just don't feel burnt out. And so I think if we're going to have the burnout conversation, we also have to ask ourselves, what is the antithesis of burnout? What are we aiming for here? Is it happiness? Yeah. So is it engagement, which is actually one of the 5 components of happiness? Is it feeling appreciation? Is it self-actualizing? Is it different for everybody? Can a management team have any chance of even achieving a happy, engaged workforce that feels meaning when they come to work? I think it's actually a good question to sort of pause and say, well, if you don't want to be burnt out, what do you want? What does going to work in a perfect world look like to you? And it's probably not sitting on the couch for the whole shift, because although once in a while that can be great, that's probably also not going to make you feel like you have meaning and engagement in the work that you do. Measuring happiness is actually a science, and there are management degrees that have courses in happiness. And happiness is a complex emotion. It's controlled by multiple neurotransmitters. It's serotonin, oxytocin, dopamine, endorphins. But feeling happy is perhaps something that we can all strive for when we go to work, even if we're burnt out. And feeling happy doesn't necessarily have to come from external sources, although it is helpful. If nobody vomits on me in 12 hours, and if people say, oh, thanks for your help, all of those things definitely help. But there is an ability in each of us to actually have an attitude that is striving to be happy. And I don't want to excuse employers and governments, that underfund us or that overwork us. I don't want to excuse all of those structural issues that lead to burnout. But one of the things I always like to do is figure out, what can I do today? What do I have control over? And you can actually do simple things to affect your own happiness chemistry. So right now, and nobody can see this because this is a podcast, but we all see each other in video. And if you smile, you can act like just there. So I smiled and then Ryan smiled. So I'll bet that if we do this for 60 seconds, one of us is going to start to giggle, and then oxytocin and serotonin levels are going to spike in your brain, and you're going to feel better. And if you don't feel like smiling, you can fake it. You can trick your brain. Do I have a pen or a pencil? I'm going to use the wire of my headphone. If I put the wire of my headphone or a pencil between my teeth and bite down, I'm going to activate my zygomatic muscles and my ocularis muscles. And that's actually going to tell my brain, oh, Blair's smiling. So I'm going to trick my brain into thinking that I'm happy. And then my brain is going to release serotonin, dopamine, and oxytocin. And then I'm actually going to feel happy. And you might measure that as a drop in heart rate, as a decrease in perspiration. So we can actually affect our own physiology, even if we're feeling burnt out. And you could feel burnt out and happy at the same time. I know that sounds super weird, but one of the struggles that we have with burnout, and Bob and Ryan, I'm interested to pose both of this to you. Actually, let's do this. Can we do a little experiment?
Sure.
Because I've been talking to a lot of psychologists and sociologists writing this book on burnout, and I've learned some super cool things. So right now, I want you to pretend that you're at work and that you feel burnt out. And now I want you to replace the word burnout with any other word in your vocabulary. So when I ask people, if you're feeling burnt out, give me a word other than burnout, I get this huge range of words. Some people say that they feel tired. Some people say that they feel angry. Some people say they feel useless, disrespected, annoyed. They feel heartbroken. They feel all these different words that mean very different things. So when we use our vocabulary in a contracted form, if we just say, oh, I feel burnt out, then all those chemicals in your brain are just going to give you that same sensation that they always have for burnout. But if we can be more specific, then it helps our brain determine what it's going to do next. So rather than being burnt out, try to be more discreet about what you're feeling so that your brain knows what to do about it. So if you're feeling disrespected, well, why are you feeling disrespected? Well, the triage nurse said XYZ or the emerge doc said XYZ. Okay, that's very different from feeling like you're lacking in sleep, right? That's very different from if you're starving to death. If you're like, I just need to eat, that's different from if you're like, a patient of mine died 3 days ago, I cannot get that wailing mother out of my head. All of those are very different experiences. And as a peer, I can offer very different support for all of those. If you're exhausted, I can say, do you want me to grab you a coffee? I can say, do you want me to drive? I can say, do you want me to drive or run the next call? I can say, how about you go lay down? I'll go wash the truck, right? Like I can do all sorts of different things when you say you're tired. I can do all sorts of different things when you say you're hungry. But when you say you're burnt out, I don't know what to do with that. That's too big. So if you can break down burnout into smaller, more discrete words, then all of a sudden, not only can the people around you do something differently to support you, but your body can do something differently to support itself. So I think when we're talking about these emotions, being more discrete on the burnout side allows us to then say, okay, just because I'm hungry, does that mean I can't be having a good day at work? Does that mean I can't be happy? Does that mean I can't feel engaged? Does that mean I can't find meaning in the call that I just did, where I moved a lady with a broken hip, and at the hospital, she told me she didn't even feel it, right? I'm like, wow, like I nailed that extrication. She didn't yelp. She didn't whimper. I did a really good job there, even though I'm hungry and tired and frustrated and disrespected. So if we can start to break down our emotions, then we can start to experience both the good and bad in more specific ways. And that might help people get through the day. And there's science to back that up, but I won't bore you with that right now. So the future of burnout is better systems, right? But until that happens, each of us can take a little locus of control about how we're feeling. And if we can communicate the way that we're feeling, we can either get help from our peers at base or on the road, or we can give help because we suddenly have that positive valence, that good attitude that hopefully can be infectious.
That's amazing, very good operational advice that I know a lot of people will appreciate. Because one last question before we let you go on your busy day, if you don't mind. What if people do come to work with burnout? How does that impact patients?
Yes. Let me seal that. Listen, if you come to work burned out, that's most likely, decreased patient care is my primary concern. If you're burned out and you're not engaged, then you're not thinking, and that means, you're not giving your patient your best. It's a lot of the signs and symptoms that we see are very subtle, and you sort of need to be on point when you get there. This is why we work in partners, right? If you're not, then hopefully your partner will pick something up. But on the off chance that you're in the back with a patient, you're just not engaged, then your patient may not receive the adequate care. If you're sort of trite with them, then, this may result in a customer complaint, at which point it's going to get investigated by management. And then that's a whole pile of undue stress that you don't want to have to deal with, which is going to take you down a different rabbit hole, at which point you're going to be even less compassionate the next time you're in because, what was me? I come to work and people complain. Oh, the customers. Oh, the patients. And it actually has nothing to do with the customer or the patients. It has everything to do with you. So that's the primary concern. It's a lot of extra stress on your partner when all of a sudden their actions are resulting in complaints or their inactions are resulting in complaints.
And Blair mentioned the financial cost of implementing solutions. I wonder if we spent more money upfront to try and prevent and treat it, in the long term, we would save more money by giving this high quality care, less complaints, less adverse effects by the implications of burnout. What do you think, Blair?
So every economist I've spoken to on burnout would totally agree with you. Burnout is more expensive than retention. Corporate people would use churn to talk about either customer loss over time or employee loss over time. And churn is extremely expensive. Recruitment is extraordinarily expensive. It costs tens of thousands of dollars to recruit somebody. And if they quit day one on the road, you're just out all of that. So churning and burning people is not the way to run an EMS service. You will make more money. You will be more effective with taxpayer dollars, purely from a financial sense, if you take care of your employees and make sure that they are happy at work and not burnt out. Then there are the immeasurable benefits of having an engaged workforce that likes coming to work. And as Bob alluded to, clinical quality definitely is determined by whether or not you are on your game or not. But also sort of that humanistic aspect of compassion is really important. And it probably only shows up in complaint metrics. I don't think people are really measuring compassion in EMS very well these days. But you cannot tell someone just to be compassionate. Compassion is a finite resource. A lot of people don't have much of it. And it's because of all these things that we've already talked about today.
And likewise, compassion, it's very difficult to be compassionate when you're burned out.
Absolutely. There's no gas in the tank. And so, we can't just keep dispensing compassion from our personal ATM if nobody's depositing compassion into that ATM. And so employers need to recognize that and certainly be compassionate towards their employees so that their employees can then pass that on to the patients in the field.
Amazing. Any last advice or concluding words from both of you, Bob and Blair, that can help support paramedics if they're feeling burnt out or want to prevent it?
Yeah. Have a select group of people at work that you can speak to. I mean, I don't care, friends, colleagues that you actually trust, that you can talk to about how you actually feel. Get a counselor early in the program. And so as soon as you're on the road, make sure you get a counselor who understands your baseline and work on yourself. I mean, the average medic is going to be on the road, 5 or 6 years, maybe. So how does this affect us? Well, paramedics used to learn by experiential learning. We used to pass information down from generations of medics, from older medics to younger medics. And this is how we learned. But this is no longer being done because people are leaving far too quickly. This is drastically affecting the way paramedics are being taught and how patients are being treated. If you constantly have a new service, then everything's new to everybody all the time. And there's no real learning going on.
Absolutely. Blair?
The only thing I would add to give a little bit of a discrete action to what Bob had said on self-awareness is every day that I go to work, I decide if I'm in the green, yellow, orange, or red zone, and I have a plan for each of those. And I think if you're in that orange zone, recognizing that you're going to need some support at work that day is really important. And finding people at work you can share that with is really important. And then knowing that if you are in that red zone, if you are in a situation where you are feeling unwell, unsafe, unmanageable, being able to reach out and, obviously there are employer services like the EAP or maybe a support team or maybe just your best friend or someone in your family, but also knowing that you can, chat with your family doctor about this type of stuff if you're lucky enough to have a family doctor. Or, in the ideal world, you have a therapist lined up, as Bob had mentioned, some sort of clinical psychologist who can help you with this. Be ready for it. You don't want to be trying to sort all of this out when you're in that zone. It just makes a bad situation worse.
A final note would be the fact that in EMS, there's no such thing as taking a mental health day. You can't call in sick and say, I'm just going to take a mental health day, even though that's exactly what it is. And that's truly unfortunate because those individuals that are calling in and saying that, they actually know themselves. They've done that self-assessment. I'm in the orange zone bordering on red. I don't want to come to work today. I am not mentally able to manage my job today. And that's not an option for me, which is truly unfortunate. I hope this changes in the future.
I agree more. Thank you so much, gentlemen. Really appreciate it.
Thank you for having me.
Thanks for having us.
This podcast is for educational and informational purposes only. It does not provide medical advice, diagnosis, or treatment. Always follow your local medical directives, protocols, and scope of practice.